ET Now exclusive next. Rising medical inflation could drive health insurance costs upwards in the upcoming years. That's the word coming in from Star Health Insurance MD and CEO Anand Roy. In an exclusive conversation with ET Now along the sidelines of a new CSR launch, the Star Health Insurance boss also said the company has passed on all GST benefits to policyholders and absorbed input tax credits in its costs. He added that the October to December period has seen a 50% spike in demand for new insurance plans and that 10% of existing customers have opted for higher coverage while renewing policies. Here's a slice of the conversation that I had with Anand Roy of Star Health Insurance.
This particular project is a culmination of our 20 years of insurance business and the learnings that we have gathered along the way in terms of how we are able to help some of the members of our insurance program, but many of them cannot afford insurance even today. And, that's a segment of the population this particular project is all about. We had done this in a small manner prior to this large-scale project that we are now going after. I think the learning is that despite multiple avenues, Tamil Nadu has one of the best healthcare systems in the entire country. But still there is a good demand for, primary health, services, which we believe that this centers will provide. So the population, the underprivileged population of this locality can avail of free services, whether it is doctor consultations, whether it is diagnostics. I think these services are never going to be out of demand, right? I mean, there's a population which always needs this. So while we are a commercial business, we believe that, it is our responsibility to also do some service to the society in terms of, and this is an extension of that.
So how many lives do you hope to impact by way of ASK itself? And I believe you have a fair presence in South India in keeping, with your business presence as well. Could you break down these two statistics for me?
Yeah. So we are opening around 32 centers to begin with in this phase one. These are going to be spread across the country, largely concentrated in South India. There's about 20 centers in South India to begin with. 5 of them are in Tamil Nadu and one in Chennai. And these centers are going to be fully equipped with MBBS doctor, with a lab technician, and with pharmacy, and so on and so forth. I think the intent is to reach about 1 million lives through this program in the first phase, and then scale it further.
All right. Let's quickly talk about insurance itself. There's been reports and a bit of talk on how premiums have been on the rise, price-wise. What would you ascribe this to, really? Is it a case of the good old medical inflation continuing to catch up, hospital billing practices, product design? What's the causative agent really behind the price rise when it comes to premiums?
Well, I think it's a combination of all of these factors which you just mentioned, Jude. Actually post-COVID, we have seen a significant amount of medical inflation in India, and it's very sticky. Okay, India has the highest medical inflation globally now, and there are multiple reports, which has been published on this. There's a 14 to 15% is the cost of medical inflation in India. So insurance premiums, obviously, cost of medical treatment is the single largest input cost for insurance, right? And if the cost of input cost is going up, then the premiums are likely to go up. So we believe that, over the last many years, the insurance premiums have been affordable. It still continues to be affordable today. But I think the fact of the matter is that because of the rising medical inflation, because of the preferences of customers to go to higher-end hospitals, to go for higher-end treatments, the cost of insurance is also likely to go up significantly.
Right. And just a word about cashless claims, something that you've actually prioritized right here at Star Health Insurance itself. With initiatives like the NHCX and the common empanelment, do you foresee a spike or an improvement in hospital insurer coordination so as to ensure, smoother claim processes, more cashless claims perhaps? How do you see this panning out across the industry?
Absolutely. I think this is the most important thing for bringing long-term, trust into this business, right? I mean, today there's a total lack of trust amongst all the stakeholders. There are 3 large stakeholders in this piece, right? It's a 3P model. There's a payer, there's a provider, and there is a patient or the policyholder. And all of them have to work in, have trust in each other. So I think better coordination with hospitals, these initiatives like NHCX, and, there's a lot of work going on amongst the hospital associations and insurance council and all of that. I think this is all going to culminate into better customer experience, better trust, and better growth for the sector.
We're doing this chat at a time when it's almost going to be exactly 5 months since the new GST, 2.0, the reforms were brought into being, 0% GST on health insurance. How has that panned out in this space? Have you continued to see benefits being fully passed on to the insured, to policy holders, despite those challenges that existed with input tax credits? How has that experience been?
So, Jude, this is something, it's a blessing in disguise. I would say that, the government has done something which is very, very critical. And we totally, are thankful to the government for this waiver of GST on individual health insurance, because it has led to two things. It has led to a significant demand growth in the sector, and more customers are coming and buying new health insurance plans.
Well, then, Star Health Insurance confirming that all GST benefits have been passed on to policy holders, even as the company warns that rising medical inflation could see costs in health insurance go up in the near future. Well, moving back to news from Kerala now, the opposition brought assembly proceedings to a halt yet again as the House was adjourned after disruptions by the UDF over the controversial Sabarimala gold loss case. In effect, this brought the final session of the Kerala Assembly before elections to an abrupt end. Opposition MLAs protested inside the House, raised slogans and displayed placards demanding accountability in the probe. They also demanded the resignation of the state Devaswam minister over allegations of political interference in the probe. UDF members then staged a walkout while continuing to raise slogans against the LDF government. Speaking to the media, Congress MLA Ramesh Chennithala said the Kerala government had lost confidence in the hearts of its people, calling it merely a caretaker government.
The people of Kerala has passed a no confidence motion against this government for the last 5 years. This government is only a caretaker government. All the by-elections we won, all the parliament election we won, and we won the panchayat election also. What more this government wants? The entire people of Kerala has given no confidence against this government. So this government has no moral authority to continue in the office. Okay, technically they can continue. But one thing is very clear. They are waiting for the assembly election. So the people of Kerala will register their protests in the coming parliament assembly election. And the UDF will come with flying colors. That is why this government is not acceding any demand of the opposition. And one thing is very clear. In the assembly, they are not ready to accede any of our demands. So now we will take it to the people. The people of Kerala will definitely give a befitting reply to this undemocratic and autocratic government led by Sri Pinarayi Vijayan.
Shifting focus to Tamil Nadu's election build-up next, Congress MP from Sivaganga, Karthi Chidambaram, has brushed away all reports of a rift between the Congress and the DMK. The MP said that the Congress High Command has in fact spoken to the DMK and that both parties will reach a consensus on seat sharing over the next 2 rounds of talks. Now, relations between both parties have been strained over reports that the Congress wasn't too happy with its lack of relevance or representation for that matter in the Tamil Nadu government. In fact, AICC General Secretary K.C. Venugopal was in Chennai over the weekend to discuss seat sharing with Tamil Nadu Chief Minister M.K. Stalin, but the party has by and large remained mum over the alliance math that it expected for the election. So let's listen in to what Karthi Chidambaram had to say today.
அங்கே இந்தியா கூட்டணிக்கு இந்திய அளவில் தலைமை தாங்குகிறோம். அந்த கூட்டணியில் திராவிட முன்னேற்ற கழகம் இருக்கிறது. தமிழ்நாட்டை பொறுத்த வரைக்கும் திராவிட முன்னேற்ற கழகம் அந்த கூட்டணிக்கு தலைமை தாங்குகிறது. நாங்கள் அந்த கூட்டணியில் இருக்கிறோம். எங்க
Staying with more poll action from Tamil Nadu, the AIADMK is all set to take a leaf out of the DMK's 2021 poll campaign. At a campaign speech over the weekend, the party's General Secretary and former Tamil Nadu Chief Minister K. Palaniswamy promised working women heads of families a universal basic income of 2,000 rupees per month should the party win elections this year. That's 1,000 rupees more than the DMK-led government is crediting as income to working women today. Palaniswamy also promised free bus travel for men, a housing for all scheme, and two-wheeler subsidies, among other social spending initiatives. Meanwhile, in Bengaluru, the Congress-led Karnataka government is considering restricting mobile phone use for students under 16 years of age, citing growing concerns about social media addiction, behavioral effects, academic distraction, and mental health struggles in children. Chief Minister Siddaramaiah raised the issue in a meeting with vice chancellors of state universities, seeking expert feedback on whether a ban within campuses could help curb harmful screen time and exposure to inappropriate content. No formal policy, however, has been announced yet, as the state is choosing to conduct consultations with educators and stakeholders first. Well, with that, we're completely out of time on this bulletin of South Central. Thanks so much for watching. Do stay tuned to ED Now for more news and updates from the channel. But for the moment, it's goodbye from us.